They say communication is key, and this is especially true with the doctor's office. Communicating with a doctor is something that we are all familiar with, but is an aspect of healthcare that does not receive enough attention. Hello everyone, my name is Elias, and today I will be reviewing the importance, dynamics, and challenges of effective doctor-patient communication. I have read several academic articles on this subject so that I might offer some tips for doctors and patients of all ages to develop strong communication skills. As a pre-med student, this topic is especially interesting to me, but it should be for you as well. The doctor's office can be an intimidating and stressful place, but as we will soon see, strong communication between doctor and patient can make all the difference. Here are the topics that we will be focusing on during today's presentation. To start, we will go over why doctor-patient communication is so crucial to the healthcare process. We'll then turn our attention to specific challenges that doctors often face while interacting with patients, before ending with advice that patients can use for their next appointment. So like I just said, our first topic is the importance of doctor-patient communication. There are several reasons why a trustworthy and strong relationship between doctor and patient is critical for the effective healthcare, and the benefits affect both parties. As you might imagine, doctors are more likely to share personal information with their doctor. The increased familiarity in turn makes it easier for doctors to make quick and accurate diagnoses. Patients are also more likely to follow advice and adhere to prescriptions when they feel more connected to their doctor. Effective communication is also beneficial to physicians' well-being. According to an article published by the National Center for Biotechnological Information, satisfied patients increase doctors' job satisfaction, reduce stress, and prevent burnout. A 2017 survey conducted by the Medscape article found that the overall rate of physician burnout in the United States is 51%, which is significantly higher than 40% reported in 2013. Doctors are clearly becoming more stressed, and improving communication with patients appears to be a viable solution. Developing more personal relationships with patients also reduces the chance of malpractice litigation, something no doctor wants to deal with. Finally, good communication has been shown to actually affect patients' health outcomes. Patients satisfied with their doctor interactions have better mental health, increased tolerance power, and a more positive attitude. Studies have even linked patients' sense of control to decreased tumor growth and shortened hospital stays. Now, hopefully all of this information reveals a common theme, that satisfaction is contagious. If doctors and patients are able to interact in such a way that both are satisfied with the relationship, everyone wins. Doctors are better able to do what they love, and patients are more likely to receive the best care possible. Unfortunately, doctors and patients do not always get along. Let's now go over some of the common challenges that prevent doctors from communicating effectively with their patients. Studies show that physicians tend to overestimate their communication skills. What this means is that patients are more likely to be unsatisfied with their interactions with doctors than doctors are. In one study, 75% of orthopedic surgeons were satisfied with their communication with patients, but only 21% of their patients agreed. It's also worth noting that most complaints about malpractice claims about doctors are related to communication issues, not clinical competency. Now, there are several explanations for the communication struggles of some doctors. Some point to medical school, suggesting that the rigorous training of med students actually suppresses their communication skills. Another article in the NCBI highlights two common mistakes that doctors often make when dealing with patients: withholding information and discouraging collaboration. Both lead to mistrust, which we all know never helps any relationship. With these common pitfalls in mind, let's now talk about what effective doctor-patient communication actually looks like. According to the same article by the NCBI, doctors should have three main goals while interacting with patients. The first is to establish a friendly interpersonal relationship. Patients will obviously be more willing to listen to a doctor they actually like. The second is to facilitate exchange of information. Patients want to understand their health conditions and treatment options, and it is up to the doctors to explain them as best they can. Finally, doctors need to include patients in decision-making. This does not mean that the patient always gets the final say, but it's important to value their input and opinions. Doctors are often forced to break bad news or deal with difficult patients. No matter the circumstances, doctors should always remain professional, empathetic, and courteous. Forming strong relationships with patients can also help doctors deal with those difficult interactions. The last topic of this presentation reminds us that communication is a two-way street. Doctors aren't the only ones to blame when communication breaks down. Patients also share some of that responsibility. Knowing how to talk to your doctor is very important. Not surprisingly, patients who establish a good relationship with their doctor are more likely to be satisfied with their health care. The following are some tips that should help you do just that. The first is to know what questions or concerns you have before you visit your doctor. Doctors are very busy and known to be quite impatient, so don't waste their time. The second has the same purpose. Providing your entire medical history will help doctors work efficiently and quickly. The third tip is to ask questions and be assertive. Don't let the doctor dominate the conversation and let all concerns be known. Don't worry, they won't be offended. Lastly, always be respectful and show your appreciation too. Saying thanks is always a good gesture. I hope all of you have enjoyed this presentation and learned some communication skills that you can apply at your next doctor's appointment. Effective doctor-patient communication is truly vital to the healthcare process, but it doesn't come easy. In order to establish a trustworthy relationship that benefits both parties, doctors and patients both must be willing to listen critically, always be honest, and maintain respect for each other, even in the most difficult circumstances.